all across America and around the world. This is Veterans Radio. This is Veterans Radio.
Welcome to Veterans Radio. I am Jim Fausone. I'm the officer of the deck today. We've got some great programs for you. We always want to remind you you can find more about Veterans Radio at its Facebook site or at the web, veteransradio.org, where we're on the web 24/7. You can find a lot of our podcasts there as well. We post new ones every Tuesday, so you can get a new story, a new interview, something you didn't know before by going to veteransradio.org. And before we get started, we want to thank our sponsors. First up, we want to thank National Veteran Business Development Council, nvbdc.org. It was established to certify both service-disabled and veteran-owned businesses. You'll find out how they can help your business by going to nvbdc.org. We want to thank Legal Help for Veterans. Legal Help for Veterans fights for veterans' disability rights all across the nation. You can reach them at 800-693-4800 or on the web at legalhelpforveterans.com. And finally, PuroClean. PuroClean is the paramedics of property damage. It provides water damage remediation, flood water removal, fire and smoke damage remediation, mold removal, biohazard cleanup. It also has a focus on veteran franchisees. You can learn more about them by going to puroclean.com. Two interesting segments today for veterans and their friends and family. First up, and I don't know that we've ever really had a discussion on this on Veterans Radio, is about the VA dental benefits that are available and VA dental insurance, which is available to every veteran. So kind of an interesting topic. And second, we're going to talk about veterans and their exposure, prevalence to Parkinson's disease with a veteran and the Parkinson's Association. Probably something you ought to listen in and learn about. Hopefully you'll never have to worry about it. But then again, so listen in. We want to welcome to Veterans Radio today the Assistant Undersecretary for Health for Dentistry, Dr. Christine LaMarre. Dr. LaMarre, welcome to Veterans Radio.
Thank you. Thank you so much for inviting me. I'm really excited to talk to you today.
Well, we're really looking forward to getting some information out to our veterans about the VA's dental policies and those benefits. But let me set this up a little bit. You completed your general practice residency at the VA Long Beach Healthcare System in California in 1998. In 2002, you became Chief of Dental Services. You've also served at Vision 22 as the lead dentist for 7 years and the Office of Dentistry Infection Control Consultant for 6 years. You were appointed the Director of Operations in the Office of Dentistry for 2021 and the Acting Undersecretary in 2023. So you have a long history with the VA, and you're an active member of the American Dental Association and a fellow in the International College of Dentists, and we're going to ask you some questions about some ADA information later. But you bring a real focus on dental health care with veterans. How did that become of such an interest to yours? And tell us a little bit about your career.
Yeah, great. Thank you for asking. So I first started off, my first love was to work with communities. Prior to coming to the VA, I ran a Ryan White clinic, which was a dental clinic for individuals with HIV and AIDS, and kind of fell in love with that sector of the community outreach. And I loved my residency. I did at the VA, and when an opportunity opened up, I looked into it and I thought this is the perfect place for me. My grandfather was a World War II 100% service-connected veteran. My father's a Vietnam veteran. So I always felt like I've been a caretaker, so to speak, of veterans throughout my life.
We often find when we ask that question that back in the family history somewhere, there are family members who have been veterans, and certainly both your father and your grandfather obviously had an impact on your career choices, I think.
Yeah, no, definitely. With my grandfather, especially with him being 100% service-connected veteran, he got all his care through the VA, and he even lived in a veteran community in Florida. And I used to spend my summers down there. We were in Michigan, and my parents would I know, kind of the opposite, right, of a snowbird, but I would go down to Florida for the summer and spend it with my grandparents down there in Florida.
Let's turn to veteran dental care, because I think a lot of people struggle with understanding how one qualifies for this benefit. Can you shed some light?
Yeah, absolutely. And that's probably the most common question we get, right, is who's eligible for VA dental care? And this question most often refers to VA-provided dental care. In order to qualify for the VA-provided dental care, a veteran would need to meet certain criteria set by law. And some veterans may have a limited eligibility, and others are eligible for what we call comprehensive dental benefits. I actually I'm going to go into it a little bit for you, but I actually have a fact sheet that I can send you if you have a website we could put up for folks to look at as well. To help with this.
Oh, absolutely. I'll give it to you later, and we'll put that up on veteransradio.org as well as its social media pages.
Okay. Perfect. Thank you. So for comprehensive dental benefits, there's about 4 categories a veteran would need criteria, a veteran would need to meet to go into that. One is they would need to have a service-connected compensable dental disability or condition, be a former POW, have a non-compensable dental condition or disability resulting from combat wounds or service trauma, or, and this is our most common category that we see in our clinics, is they have a service-connected disability rated at 100% or unemployable and paid at the 100% rate due to their service-connected conditions.
So if I have what's commonly known as TDIU, which gets me rated at 100%, that would be that 4th category?
Yes. And then we do have some limited categories of care. So, and I'll give you one example of that. For a veteran who's been recently discharged from the military, they would become eligible for one-time dental care if at the time of discharge they did not have all of their dental treatment completed by the military, and that was notated on their DD-214.
These categories are pretty clear. I don't know why they're not so well known. As you've explored this issue as the Assistant Undersecretary for Health for Dentistry, why doesn't the message get out more, do you think?
That's a great question, and something we absolutely are pondering as well. And it's just a lack of awareness. And so I think that folks are not really sure. Dental's kind of that area of the hospital that maybe they're not as familiar with, and they are not just aware of that. Sometimes people have their own dental insurance, and so they think, oh, well, I have a dental insurance, I can't use the VA dental. Well, that's actually not true. You can use your own insurance and you can use the VA dental benefit, but we want every veteran to use all of their earned benefits, especially their dental benefit.
Absolutely. They earned them through their service, and they shouldn't be shy about using them. I saw in some research that VA provides medical care for about 9 million veterans, but only about 1.8 million are eligible for dental care, and only about 40% of those who are eligible actually use the care. So there's a big gap between those who are entitled to and those who actually use the care. One of the questions I guess I'd have, and this seems awfully naive on my part, but does every VA hospital have access to a dental clinic?
So every hospital except for one has a dental service associated with it. So when I say that, what I mean is You might have a hospital in a location, and then in the CBUC they have dental clinic, or it could be in the hospital. But we do have dentistry associated with every hospital except for one in the country.
And so the dental services might be provided. You mentioned a CBAC, which is a community-based outreach clinic. So it might be in the clinics versus in the hospital. Is that what you're saying?
It could be, absolutely. We have many in the hospital, but, depending on the region and the access and where the veterans live, we do have them in different locations.
Now, I saw a report from some researchers at the American Institute of Dental Public Health and CareQuest Institute. I don't even know who all those people are, but they say that veterans have a higher rate of dental problems than the civilian population, including issues with tooth decay and gum disease. Does that sort of track what you have found in your role as Assistant Undersecretary for Health for Dentistry?
We do see, I would have to look, I'll be honest, I haven't looked at the literature exactly what you're referencing, but we do see our veterans have a high rate of periodontal disease and dental caries. I think, though, when you look at some factors such as the age of the population we're treating and other things, that it might be closer to the norm with that. But we definitely make sure we're focusing, because we know that is very important to our veterans. And so there's a couple of things we really look at. We have some quality indicators in place to make sure we're getting patients in for recalls. We have fluoride interventions and all these different preventive things that we focus on, because we do want to make sure that their oral health is optimized.
Yeah, I think there's a general recognition nowadays that your oral health does relate to your overall physical health, doesn't it?
Yes, absolutely. Oral health is part of whole health, and we've had some articles out there that absolutely do not necessarily its cause and effect, but it can have different, we know it can affect those chronic diseases.
So what services, Dr. LaMarre, are actually available? Is it just cavities and pulling teeth, or is it cleanings and x-rays? I mean, when we talk about available dental services, broaden that out for us a little bit.
Yeah. So we offer the full gamut of dental services outside of maybe a couple of things, and I'll get into those as well. But we offer everything from exams and x-rays, fillings, all the way up to implants. So we have a full gamut of services. I think what is maybe sometimes difficult to understand about the VA versus just going into your private dentist is that we don't have a list of things that it says you can have these things. We create a customized treatment plan for every veteran that comes in.
That's a big difference, because in the private sector, it's what does your insurance allow, and we'll do this.
Exactly. And that's where we focus on what is going to get you to that optimized oral health. So, that is our focus. And sometimes we might say, this is what we are going to do today. Let's get your oral health up to that, and then let's move on to that next step and see what we can do then. But we sometimes we really take a long range approach where our focus is on, let's get you up to that optimized oral health with this customized treatment plan.
So as somebody who's not a big fan of dentists and who's had root canals and crowns, I assume your treatment services include those sorts of things, and maybe even dentures?
Yes, absolutely. We include crowns, partials, dentures, root canals, you name it. We have all of those things. And we even have, in some of those areas, we have residency programs teaching people how to become specialists in some of those arenas. So we definitely provide all of those services. I'll go back because I realized I didn't mention the couple of things that we don't do. We don't do dentistry purely for cosmetic purposes. And then orthodontia is not something we offer unless you need orthodontia as a result of a sinus trauma condition.
Certainly, yeah. One of the I'll come to the challenge in a minute, but you mentioned residency, and I always like to take a minute to remind people, and I assume it's true in your area, because you did your residency, general practice residency at VA Long Beach. I think people forget how much training the VA does. Can you, and this is medical doctors and nurses and PAs and everybody else, I never thought about the training, the teaching it does in the area of dentistry. Can you elaborate on that a little bit?
Yeah, we have incredible training programs. We have general dentistry residencies. We have specialty residencies in the VA. We even have dental hygiene. We even have some dental assisting programs that come in to our clinics. And what's great about this is it becomes our program where we tend to know, people get to know about the VA and then they want to come work for the VA. So when I go and post for positions, I've got folks who've come into my service who know already about the veterans and our mission and want to be part of that. And so I have to say, when I was the chief, I think almost all of my dental staff had done a residency at a VA.
No, that's excellent. And again, I think one of the great unsung stories to the general public is how much the VA does in research and training, and that's a benefit to the whole community, not just the community of veterans. Let me ask about the challenge, though. I suspect like many VA services, there may be challenges about staffing and having enough personnel and budget to meet the need. Can you talk about the challenges?
Yeah, absolutely. So last year, VA dental clinics, we provided 5.5 million procedures to more than 560,000 veterans. And that still didn't meet all of our need. In addition to that, we spent $1 billion in the community because we needed to make sure our veterans had access to care. For the Mission Act, I'm sure you're familiar with the Mission Act. Those standards apply to dentistry.
Okay, I was going to ask that. That's good to know.
Yeah. So, for example, when I talked about veterans in Vermont, we're not just letting veterans in Vermont go without dental care. We still serve them through community care. And that would be one area where you would see that. So if we can't provide that care in-house, we will provide that care in the community, or if that veteran meets that drive time standard as well. So that's the challenge. So originally, going back to your question, our challenge is more having space, having dental treatment rooms is really the challenge we're facing right now to get all of our eligible veterans in, especially in where we're seeing these areas of the country with large growth.
And that is a very complicated question because it takes congressional dollars to build out all those rooms and add all that equipment before you can even get to the personnel issues, isn't it?
Right, exactly. That's exactly right. You have to have that space to treat that veteran. And then we're doing, bringing in folks. I have to say, because of those training programs we have and things like that, we've done fairly well with being able to recruit dentists. The area right now, and this is true not just in VA, but across all of dentistry, the American Dental Association has spoke about it, but we're seeing a nationwide shortage of dental assistants and dental hygienists.
Help the uneducated out like myself. What's the difference between an assistant and a hygienist?
Sure, absolutely. So a dental assistant is that person who you usually see helping the dentist when you're getting your treatment. The dental hygienist is the person you see when you go in for your cleanings. And those would be, every 6 months when you go in for those cleanings in your dental office. Usually you see a dental hygienist.
Right. So let me go on to another area that may become a challenge. And there's been some articles written on because of the 2022 Promise to Address Comprehensive Toxic Act, better known as the PACT Act, that we're going to see a lot more veterans qualifying for dental benefits. Is that something you're thinking about now in the office there?
Oh, absolutely. We have absolutely, that's one of the areas, the strengths of our office is Dr. Trapp, who I think you read about in that ADA article you mentioned at the beginning. We have a dental resource model that is a data-driven model along with geospatial information that looks at and predicts where will our veterans be, where do we need to build our clinics for that. In addition to that, we are looking at one of the wonderful things the PACT Act did was give us these different authorities to expand. And so we've gone into agreements with lease agreements with the Department of Defense. We're seeing more and more joint DoD VA clinics. We're looking at leases in private, a dental office that maybe is vacant. Can we lease that space and use it, as well as traditional expansion? So all of those things are being put into place.
Well, that's one of the things that I think, again, the VA does a pretty good job of it, which is trying to think ahead about where is this going? What do I need to be doing? I meaning VA. What does VA need to be doing to address these future set of complexities? There is another benefit I wanted to talk about with you, and that is the VA dental insurance program. I'm sure that if I had 100 veterans in the room now, okay, I'll say one of them might have ever heard of this. I'm not even sure if one has. Can you talk to us about this?
Yes, absolutely. So the VA dental insurance and program, if a veteran does not qualify for VA dental care, or maybe they only get limited care and they're enrolled in VA healthcare, they have the option to enroll in a Veterans Affairs dental insurance program. And what that is, that's administered by Delta Dental and MetLife, and you can, it's similar to what I, as a VA employee, can choose for my own personal dental insurance. And there's different programs, different levels, different geography. So for example, you can do a veteran-only plan with maybe, it gives you your traditional cleanings, exams, and then would cover maybe some work at 50% for maybe $20 a month. And then it also can offer extensive programs where it covers more extensive procedures, maybe those root canals and crowns you were talking about. And you can also sign up with a veteran and spouse, and that could maybe be about $60 a month for that more extensive plan, depending, of course, on your geographic location. It varies.
And this is available because I have my veteran status. I don't have to be a member of a union or part of this company or that company. I can sign up for this because I'm a veteran.
That's correct, but you do have to be enrolled in VA healthcare.
Yes, absolutely. Yeah, we remind everybody of that. And even if you aren't entitled to healthcare under any of these various circumstances, you should still be enrolled in VA healthcare when that day comes that maybe you need it. So
Exactly. I have this argument with my father. And that's one of the great things the PACT Act did, was I actually got him to sign up for VA healthcare when the PACT Act came out, and I used, during COVID, he could have access to different services. The VA was at the forefront of offering if he'd been in part of healthcare, signed up.
And as I say, the dental benefits aren't really widely known, and the dental healthcare insurance, boy, that was a first for me. Before we close up here, I want to give you the chance to cover anything that I've not mentioned where you go, well, people don't know about this either. That's why he can't ask. So what did I not cover that you think I want to get out to the wider veteran audience?
Yeah, no, thank you for doing that. I think that VA dentistry we're here for the veterans' oral health. That's why we're here. And our providers, we have a dental patient satisfaction survey. And people who come in and see our dental providers are 9 times out of 10, most of the time, they're rating our providers and the care they received very highly, and that's very important to us. And like you said, you're not a huge fan of the dentist. The best way to make sure you don't have to come in is through prevention.
Absolutely.
So even though you don't want to see us before you have to.
Absolutely. And we want to thank Dr. Christine LaMarre, Assistant Undersecretary for Health for Dentistry at the VA, for coming in and talking to us today to spread the word about the services that are available, the amazing work that the dentists do, both in terms of training and research, and help get the word out on something that maybe people didn't know about, which is the VA dental insurance program. Dr. LaMarre, thank you for your time today.
Thank you for inviting me on and letting me get the word out to veterans about VA dentistry.
Okay, let's admit it. You didn't know anything about VA dental before you heard this program. That's why we do Veterans Radio. We want to get information out to our veterans, to their friends and family about benefits that veterans have already earned because of their service, and really the wide range of things that may be available from the VA that, gosh, you just didn't even know were there and may make your life a lot easier. And as I said during the discussion, I had never heard of VA dental insurance. So even that you have access, your family has access to an insurance program, government designed for dental insurance because you're a veteran. Pretty cool stuff, and I'd encourage people to look into that if that's an item that they're missing from their healthcare portfolio. So stick around. We're going to have a few words from our sponsors, and then we're going to have a discussion about really a dreadful disease, Parkinson's disease. But again, one of those things that you have to know about. You have to know how it relates to veterans and maybe your service, and how there are services, there are national providers available to ease this process. I actually just this week had an opportunity to mention this, to a family that's struggling with a recent diagnosis. So listen in.
Military veterans touch everyone's life. I'm guessing right now you're thinking of a veteran, a close friend, relative. Maybe it's you. Even the toughest of us sometimes need help, but don't know where to turn for support. You don't need special training to help a veteran in your life. Even small actions can make a world of difference. If you know a veteran in crisis, please call the Veterans Crisis Line, 800-273-8255. 800-273-8255. A message from the U.S. Department of Veterans Affairs.
If you have a VA claim denied by the Board of Veterans' Appeals, contact Legal Help for Veterans at 1-800-693-4800. They're experts in handling cases before the U.S. Court of Appeals for Veterans Claims. Their number again, 1-800-693-4800.
March along, sing a song with the army of the free. Count the brave, count the true, who have fought to victory. We're the army and proud of our name. We're the army and proudly proclaim. First to fight for the right and to build the nation's might, and the army goes rolling along. Proud of all we have done, fighting till the battle's won, and the army goes rolling along. And it's high, high, hey, the army's on its way. Held off the cage is loud and strong. For wherever we go, you will always know that the army goes rolling along.
So we're giving a little shout out and love to the West Point, to the Army. This is football season, and us guys in the water, whether you be Navy, Coast Guard, NOAA, Merchant Marine, we got to look to the Navy football team to represent. But let's face it, this year it's Army. Army's whooped on everybody. They continue the season. I think they got the Commander's Cup well in hand. But enjoy football while it lasts. It is November, and soon we'll be, moving over to hockey. But we got a month or two here of playoffs. It ought to be fun. But that's why we did the Army. song. And now we're going to talk with folks on this, as I say, a really horrible disease, Parkinson's. But there is hope and there is support. We want to welcome to Veterans Radio today a couple of gentlemen. We're going to talk about Parkinson's disease and its involvement and relationship with veterans in your service. We're going to talk to Mark Kelm. Mark, welcome to Veterans Radio.
Well, thank you very much, Jim.
We'll talk about his military service here shortly. But we also have on the line John LaMarre, who's the CEO of the Parkinson's Foundation. John, welcome to Veterans Radio.
Thank you so much, Jim. It's a pleasure to be here.
Mark, let's start with you. A nice kid like you from Minnesota. You joined the Army Reserves in 1989. You served on active duty for a few years. You spent some time in the National Guard. You held a role as a military chaplain. Flesh that out a little bit. Tell us some more about your military service.
Sure. From 1989 until 1996, I was an enlisted guy. I served in the 205th Arctic Light Infantry in the Army Reserves, and then transferred over to the 34th Infantry Division with the Minnesota Army National Guard. In 1996, I was commissioned an officer, a second lieutenant, and I served in the New York Army National Guard and had active duty time on after that. So it's kind of a career that went from 1989 to 2006, and I loved almost every moment of it.
Nobody believes it if you say you loved 100%, because we all had those situations like, what the heck did I volunteer for?
Exactly. But proud to serve, and actually found a lot of the people who served along with me are some of my lifelong friends that I know I could call up at any moment and they'd be here for me. And they certainly have during my trials and tribulations living with young onset Parkinson's disease.
Well, let's start there a little bit too, because that's what we're focusing on, is explain to people what the Parkinson's disease is about.
Yeah, so Parkinson's disease can be caused either by genetics or environmental factors or a combination of both. It actually is the cells within your basal ganglia that create dopamine are dying, are collapsing in on themselves. And so when you don't have dopamine, it's like a car engine that doesn't have oil. It's going to seize up. When it seizes up, it causes certain symptoms. Some of the cardinal symptoms of Parkinson's is the tremor that you might find. Often you'll see it in someone's hand visibly. It could be in their leg. They could have an internal tremor. You'll notice slowness of movement, rigidity within your muscles. Balance can become an issue with people with Parkinson's. So there's a constellation of things that Parkinson's can have, and not everyone has all of the symptoms. Some people have worsening of their tremor. Other people, their tremor is well controlled with levodopa, the medicine that we take, but their balance isn't helped. So you never really know exactly how it's going to affect you compared to everyone else.
And John, let me bring you in on this. Maybe you want to expand a little bit about the longevity of this disease process and kind of what folks experience over time.
Yeah, so I'll just say, Parkinson's disease affects 1 million Americans, and we have a new study that shows that each year 90,000 individuals are newly diagnosed with the disease, which is a 50% increase over prior estimates. What we always say about Parkinson's is it is primarily a disease of aging. That is, the number one risk factor for Parkinson's is, age. So the older you get, the likelihood the greater the likelihood that you may develop Parkinson's. But again, it's a relatively rare disease, not a rare disease, but relatively rare disease. And as I said, people will develop it, let's say, in their early 60s. May live a full and long life. They may have, a fairly benign course of disease. Some people have a much more aggressive course of disease and, may not live as long as you would hope. And then about 4 to 5% of people are classified as young onset Parkinson's disease. Those are people who are diagnosed, before the age of 50. For people with young onset Parkinson's, we see them living, for many, many years. But we say at the Parkinson's Foundation, and you'll hear this throughout the community, that no two people will have the same course of disease. It's a very idiosyncratic disease. So somebody with a lot of symptoms and a lot of restrictions on their lives, may be living next door to somebody who's living relatively without a lot of complications from Parkinson's. But it is a tough disease. It's progressive. It's degenerative. Every day is going to be a little bit, maybe not measurable, but a little bit harder than the day before.
Yeah, and I think most folks have some understanding of it. They've probably seen Michael J. Fox on TV talking about the disease and the work that he does in this area and the fundraising and volunteer work. One of the things that you've done, Mark, is sort of taken your experience as you've now gotten out of the military and had to stop working full-time because of Parkinson's, and you've really put that energy into volunteering in the Parkinson's community. Tell us some about your work in that space.
Yeah, for me, living with early onset or young onset Parkinson's disease has encouraged me to say, I don't want to stop living. I want to get off the bench and be in the game. And so I started an annual Parkinson's Awareness Day at Target Field in partnership with the Minnesota Twins. I've organized events such as trivia fundraiser night to raise funds for the Minneapolis-based Struthers Parkinson Center, which is a center of excellence for the Parkinson's Foundation. Got the American Legion heavily involved here, Chesterbird American Legion in Golden Valley, Minnesota, to raise funds for Parkinson's as well. I've taken on the role of National Chair of the Parkinson's Foundation People with Parkinson's Council, which ensures that the perspective of people living with Parkinson's is integrated into the Foundation's programs, development, and priority settings. I volunteer on the U.S. Department of Defense's congressionally directed medical research program's Parkinson's Research Program as a consumer advocate, participating in the evaluation of research applications. And I also participate in Moving Day Twin Cities, and my youngest daughter took over for my oldest daughter, serving on the Twin Cities chapter board for Moving Day.
Let's make a little more connection here between veteran status and service and the possibility of Parkinson's. I've read that there's about 110,000 veterans with Parkinson's disease who receive care through the VA hospital. And there is such a connection in kind of empirical studies that the VA recognizes Parkinson's disease as a presumptive illness from exposure to Agent Orange and other herbicides that one gets exposed to during military service. And you're on DOD committees. Talk to us about what veterans ought to be thinking about as it relates to, did I get exposed? Is Parkinson's related, and why that's important?
Sure. As you mentioned, for our Vietnam-era veterans who experienced Agent Orange, 50% of the active ingredient in Agent Orange is a chemical known as 2,4-D, which, amongst causing things like cancer, it also can cause Parkinson's later on in life. And that's something that became presumptive. So if you have Parkinson's, you served in country in Vietnam, you can end up having a service connection between the two and get the help that you need from the VA. I'm one of the 110,000 veterans who works with the VA on healthcare, and they've done a great job for me and for my family. It's not just the Vietnam era, though, with Agent Orange. It's also Desert Storm people, people in training in the military who receive traumatic brain injuries during their service. If you have in your medical history a TBI that was considered moderate or above, you actually can be service-connected with your Parkinson's disease if you have that diagnosis. Chemical exposures go way beyond Agent Orange in Vietnam. We know with Iraq and Afghanistan that the burn pits that were there, we're seeing Parkinson's come out from troops who were living nearby or working in and through those burn pits. And so there's different ways that the military community can end up having experiences such as traumatic brain injuries from IEDs during training incidents, during combat, along with chemical exposure that is seeing a rise amongst the veteran community compared to the civilian community. And so we're trying to raise awareness, saying, hey, if you have any of these cardinal symptoms of Parkinson's, go in and get checked out.
And it's important because the things medical science and VA's understanding of things keep evolving. Just like they said, okay, well, we used Agent Orange in Vietnam. Okay, we'll admit we used it in Korea. The PACT Act now says, oh yeah, well, we used it in Thailand and Guam, and there's some places in the U.S. So there's sort of evolving exposure opportunities. And you might have known you were exposed, although they don't recognize it yet, or they're just beginning to recognize it. So this is not something that you just say, well, they said no, so I walk away. And it's important, isn't it? Because it gives the veteran, it may give them disability benefits, but more importantly, it also gives you some health care benefits that take a lot of pressure off the family, I suppose.
Absolutely, Jim. From the military training, we're taught never give up, never surrender, adapt and overcome, right? And so even if the VA says no, it doesn't mean you need to quit. We now know, like Camp Lejeune, the drinking water in Camp Lejeune.
Excellent point, yeah.
Yeah, right. So those troops who served now over 30 days and over in Camp Lejeune and were drinking the water, and they have Parkinson's disease diagnosis, can be service-connected now, where for decades the VA said no. Now there's a service connection that's going to be automatic for them. And so even if you've been said no, don't give up the fight.
Well, the other thing, and I'll jump back over to in a moment here to John, but Mark, one of the things you and I were talking about before we got started was that, a private medical physician is going to look at a veteran a certain way, whereas a VA doctor who knows what you went through is going to look at you a little bit different. And you've kind of experienced that, I suspect.
Absolutely. There is a difference. A lot of times civilian doctors and neurologists don't even ask us about our military experience. It's not in the forefront of their mind when they're thinking of what the diagnosis might be. There currently isn't a test that's widespread that's used right now to detect Parkinson's. It's really the neurologist looking at you and excluding everything else first. So we really want to make sure that if you served in the military, you had chemical exposure, you had traumatic brain injuries, that you make sure you say something to your doctor, because they can start connecting the dots then. And the VA doctors within neurology, some of them the best. I work with Scott Lewis out of the Minneapolis VA. He is absolutely outstanding, where he does take the time to read through a person's military file or 201 file to find out what experiences you had and what that could do in relation to your health.
John, isn't one of the frustrating things for patients and Mark just referenced it, well, they exclude everything else, then you must have Parkinson's. Talk to us about, how that diagnosis comes about and sort of what resources does the Parkinson's Foundation have for those who might be thinking, I don't know if I'm asking the right questions here.
Yeah, it's a really great question. So one of the biggest challenges in the Parkinson's space is that a diagnosis of Parkinson's is done clinically. I have type 2 diabetes, and you can get a blood test and an A1C test to say, look, your blood sugar is too high, whether it's on a daily basis or over a longer term period. But in Parkinson's, there is no there's no clear and widely used biomarker. So clinical diagnosis happens when you go in, you start to suspect yourself of having something that's not quite right. So you go in often to your primary care physician, and they start to look at you. And if they see the resting tremor, or they see some challenges with your gait or your stability or your walking, then they'll probably refer you to a neurologist who will make the clinical diagnosis. One of the interesting breakthroughs that's happening right now is we're in the hunt for good biomarkers. And about a year ago, there was a study that came out that said you could see alpha-synuclein aggregation in spinal fluid. So alpha-synuclein, Mark was talking earlier about what Parkinson's is within the basal ganglia. But essentially what happens is you get this aggregation of alpha-synuclein, which kills off your dopamine neurons. And so if you can find that aggregation in spinal fluid early on, that means you could be diagnosed much earlier and get on a treatment regimen earlier, start exercising and doing all the things that you need to do to take care of yourself. But more recently, there's a study that's come out showing that you can find alpha-synuclein aggregation in skin biopsies, a much less demanding way to get biomarkers than a spinal tap, for sure. So there's a lot of progress being made on improving the diagnosis of Parkinson's disease and essentially setting the clock backward a little bit or forward, whatever the right way to do it is, so that you can get diagnosed you can get diagnosed earlier with more definitiveness.
Hey, John Lehr, who's CEO of the Parkinson's Foundation, if people want to find more about what the Foundation has available in terms of resources, where would they go?
Yeah, the best place to go is to our website, which is parkinson.org. That's parkinson.org. I can tell you, Jim, we just were pleased to report within the last week that we had 7 million unique visits to our website this year, which is a record for us. And that means a lot of people are going to our website, multiple times to get the information they need. But we also have a helpline, which is 800-4, P as in Parkinson's, D, disease, info, INFO. So that's 800-4PD-INFO. And so our helpline is staffed by medical professionals who are experts in Parkinson's care. And we field about 25,000 calls a year. A lot of times it's people just asking, what is Parkinson's? Where might I get treatment? What are these signs or symptoms about? A lot of referrals, but, our people will be on the phone with people for, maybe as short as a minute, but, as long as an hour or so. So that's another resource for people.
And if a military veteran calls in, John, and says, hey, I was in the service, is that something your, folks are attuned to?
Absolutely. And as we mentioned at the top of the call, there are 110,000 individuals in the United States who are veterans who live with Parkinson's disease. That's 10% of the overall population. So, we offer a lot of things. We have a whole guide, frequently asked questions guides, which is specifically developed for people for veterans living with Parkinson's disease. We also offer a Veterans and PD webinar series, so it covers all topics that are important to veterans, around planning for the future, environmental exposure, managing mental health issues. And as I said, we have our website, which has general information, and then our helpline that can get much more specific. And those people on our helpline, they speak to a lot of veterans, and they're very good at addressing veteran issues.
Well, as we know, it's not just the patient, it's the whole family that has to address these issues. Mark, you're particularly lucky in your faith and in your family, your wife in particular. You want to talk a little bit about the importance of those issues?
Absolutely. I happen to have 3 kids, a 22-year-old, a 20-year-old, and a 16-year-old, a wife of 23 years, and I've been absolutely blessed by that. They are my support network that helps me live well with Parkinson's. A lot of times people, when they find out that I have Parkinson's, will say, I'm sorry. And I'm like, nothing to be sorry for, right? I'm living well with Parkinson's. Getting the diagnosis for me was not a death sentence. It was information. It was information about what was going wrong with my body and how I could work with the Parkinson's Foundation to learn to live the best quality of life that I can, and also for my family to understand how they can support me better in living a quality life.
Yeah, and one of the things I want to tie back to veterans and why, if you're a veteran or a family member or friend, you want to think about this connection. If your Parkinson's is connected to your military service, the VA has a lot of programs for caregivers as well, and I don't know if you've used any of those yet, Mark,
yes,
or if you've had
absolutely.
to go ahead and talk a little bit about the support that VA gives to its caregivers.
Yeah, so the caregivers themselves have classes where they meet together once a month. My wife has been part of this. Part of it is just a social time, right? For spouses and partners, significant others, caregivers in our life. There's even children who are caregivers. Who will end up logging on, and half the time is spent socializing, supporting one another, and the other half of the time is getting information. They'll have doctors speak, physical therapists, occupational therapists, speech therapists, each giving information to caregivers to help them better understand what's happening during the progression of the disease and how they can assist their loved one. For veterans, the Parkinson's Foundation also has a specific spot on our website that you can go to and get great information. As our CEO, John LaMarre, said, go to parkinson.org, parkinson.org, and then add /veterans, parkinson.org/veterans, VETERANS. And there's an amazing amount of resources there to help the veteran community.
Well, I mentioned this too in setting up this interview with John LaMarre, CEO of Parkinson's Foundation, and Army and National Guard veteran Mark Kelm, that I have some family involvement here, and actually I'm kind of dedicating this interview to my uncle John Roy, who is an Air Force veteran, because he was a caregiver for probably 30 years to my Aunt Joanne, who had Parkinson's and ultimately succumbed to it last year. You don't die from Parkinson's, you die from all the other stuff that kind of goes along with it. And I think it's important that we get out and have these kind of discussions, and people aren't like either super afraid of the disease or think, as Mark, you mentioned, it's not a death sentence. You just have to, I liked your language, you have to learn to live well with the disease, and I think that's the great spirit and the fighting spirit that I'd expect somebody from the Army to give me. Any final words here, Mark?
Don't be afraid to ask for support. I have asked for and received support from my friends, family, medical team, and faith community. You don't have to do this alone. You're not a one-man army.
John, any final words for our veteran radio listeners?
Yeah, well, just first to thank you, Jim, for putting a spotlight on veterans who are living with Parkinson's disease, and to thank Mark Kelm, who also serves as our chair of our Parkinson's Policy Advisory Council and does an outstanding job on that. It keeps us, well advised on all the issues related to living with this disease. We're really grateful for the opportunity, and just to thank all the veterans who served, and then all the veterans who unfortunately have come down with this difficult disease. We're here to help in any way we possibly can.
Well, I want to thank both of you for helping get this information out, and again, we had to kind of adjust schedules, and I really appreciate everybody being available. Thank you.
Thank you, Jim. Appreciate it.
As I said at the outset, these are stories you're not else. You didn't hear about VA dental care anywhere else, and this relationship between military service and Parkinson's, and then what life is like with Parkinson's and what resources are available. That's what we do on Veterans Radio. We bring you stories that we know you should hear with information about maybe stuff you didn't know. So it's an important project, if you will, that veteransradio.org is all about. We've been on the air now, 21, 22 years. We can't do it without our sponsors. Those sponsors include nvbdc.org, the nationally recognized leader in veteran-owned business certification, the VA Ann Arbor Health Care System, the Vietnam Veterans of America National, the VVA Charles S. Kettles Chapter 310 in Ann Arbor, the VFW Graf O'Hara Post 423, and the American Legion Presscorn Post 46 in Ann Arbor. And recently we've added on the sponsor PuroClean, which is focused on disaster relief. It's owned and run by veterans. They have a veteran discount for gaining a franchise. They love the work ethic of veterans. But look up PuroClean.com for more information. We bring you these stories every week, actually twice a week. We have our Sunday program, Monday program that you're listening to presently, but we also every Tuesday post on our podcasts. So you can find those on all the platforms, whether you're iTunes or Google, YouTube now, Spotify, all the platforms carry veteransradio.org. Get it, find it, subscribe to it, and you'll get our weekly Tuesday 11 a.m. podcast which again will tell a different story, probably not one that's going to make it to the air, but maybe it will at a later date. So it's really a combination of things that we do to try to keep people informed. And as I say, you can't do this without the listeners. So if you have questions, send them in to Dale@veteransradio.org or Jim@veteransradio.org. If you have benefit questions, what's VA doing? Maybe some questions about what the military is doing. We're trying to answer all of those in a way that helps get the information out to others. If it's a question you've got, it's a question somebody else in the audience has. So don't be shy about it. Send us emails. We love that as well. It is a process that takes a lot of time. It's a labor of love by all of us. And we often have what I would consider cutting-edge discussions, maybe before it hits the general press. You certainly see that in many of our conversations with thought leaders. It hasn't quite yet made it to the general press, and then it finally breaks its way through. We have stories on PFAS contamination that is a good example of that, or what happened to those who went to K2 in Uzbekistan as part of the Afghan war. So listen in. You'll be ahead of the curve. You'll know more of what's going on than others. And we really appreciate you listening in. We're going to go out with the Marine Corps song in light of their upcoming birthday here on November 10th, created in 1775.
From the halls of Montezuma to the shores of Tripoli, we fight our country's back.